Hello, everyone, and welcome. Thank you for attending today's webinar. My name is Kaylee. I'm with the Fullscript marketing team, and we're very excited to be hosting this webinar with Hyperbiotics today. Today, we're going to hear from Dr. John P. Troup and Dr. Diane Alexander. But before we get into the presentation, I'm going to go through a little housekeeping. I just want to remind everyone that this presentation is being recorded. So everyone who registered will get a copy of the recording as well as any other resources we can provide. It also lives on Fullscript's website at fullscript.com/webinars. So you can access it there at all times as well. So again, I'd like to thank John and Diane for being here today with us. John Troup serves as the Chief Science Officer for Hyperbiotics, where, with more than 25 years of experience, he provides key insights on the innovation, selection, and use of Hyperbiotics products and advances educational insights to help practitioners and consumers select these products. Dr. Troup has served as a member of the senior management team at several Fortune 50 consumer nutrition health businesses, and he also led teams at several dietary supplement companies, including Metagenics and Standard Process. We also have Diane Alexander with us, who is currently the North American Sales Director for Probi USA. She received her bachelor's degree in microbiology from Penn State University and her doctorate in microbiology from Washington University in St. Louis. And has authored over a dozen scientific publications. With over 10 years in the dietary supplement industry, Diane leverages her training as a microbiologist to connect clinical research demonstrating benefits of probiotics with commercial solutions enabling consumers to improve their health. So we have a great couple hosts with us today. With that all being said, I'm going to pass it over to our host to take it away, and I will pop back in for a Q&A towards the end.
Great. Well, thanks everybody for taking the time to join us this afternoon. We're excited to share with you some new insights on what we now know about the microbiome, and hopefully will help you and guide you in selecting what is the right probiotic product to use. It's probably the #1 question that we get, and probably is shared across the industry, is how do I know what probiotic to choose from? So at the end of this discussion, we hope that we'll provide some clarity or at least some guidelines for you to look at when you try to make that decision, and particularly when you're recommending products to your patients. Hyperbiotics has been around for about 10 years or so, and during that time, we've had the good pleasure of working very closely with Probi, who's really a leader in the science in the development of probiotics. And so Diane, I'm glad to be able to share this presentation with you all and share some of the insights, the science of Probi, and some of the product positioning and clinical practices that we developed with Probi through Hyperbiotics. Diane?
So this year was a very big year for Probi. We celebrated our 30th year of business, and Probi was founded by gastroenterologists who were looking to improve outcomes in their patients after gastrointestinal surgery. And they discovered a number of very powerful strains that really improved the health of their patients, and they were innovative enough and entrepreneurial enough to bring those strains to market, which is where we're at today, still offering those strains to improve the health of consumers across the world. Go ahead, John. So our mission at Probi is to provide high quality probiotics backed by science, cultured care, and manufactured into novel forms. And this mission enables us to provide healthier lives to consumers all around the world. Go ahead, John. And we're able to offer a variety of strains for Hyperbiotics to benefit different consumer groups and to provide a number of different health benefits.
Great. So that's a little bit of a background and kind of what brings our two companies together, and the basis for what information we're going to share with you today. It's all a scientific approach with clinical perspectives that has been developed over 30 years. So during the course of the presentation, the next 50 minutes or so that we have together, we're going to talk a little bit about digestive health and point out some new trends that are really important. It's not so much about the microbiome anymore as much as it is about the metabolome of the microbiome. And that's a fundamentally important point in how to select and why certain products should be selected to support that. it's also now more and more becoming obvious that the gut is core to managing entire systems of the body. And we'll talk a little bit about what those systems are and how the right set of probiotics can be used to help influence the metabolic processes that are specific to every system that affects some type of condition or even a progression to some type of compromised health state. So we'll talk a little bit about that, and then we'll talk about the selection criteria on how to select a probiotic, what to look for in a probiotic product, why that's important, and some of the science that's really important in being able to manage specific patient groups and specific conditions that you see in your clinics every day. So 22% of Americans have digestive disorder, and we now know from the recent USDA dietary guidelines released about a year ago now that 6 in 10 adults are living with one or more diet-related chronic diseases. That's resulting in about 70% of Americans that are complaining about frequent digestive disorder, with 50% or more of these patients reporting discomfort for 6 months or longer. Part of the problem is that affects the gut is the high load of sugar, the changes in processing of foods that contribute into a negative flora, if you will, of the gut. And in particular, if you think beyond sugar or high fructose corn syrups as having negative effect on the guts, one of the primary ingredients that you'll see in a lot of food products and other products in general across the world is maltodextrin. We now know today that maltodextrin has a negative effect on the microflora and the metabolome of the microflora. And it's all those things that have contributed to this high incidence and prevalence of digestive disorders and digestive discomfort. So I think we all are familiar with the concept that really it's about gut feel, right? The gut is central to nutrition and digestive processes and the availability. We also know two important components make up the gut. 70% of the immune system is in the gut, but 15% of the nervous system that's leaving the gut goes to the central nervous system and to the brain. And it's a core connection that creates a network across all body systems. And that's important because 15% of the central nervous system is made up of the immune system. So when you combine the fact that 70% of the immune system is the gut, and the influences of the metabolites that are in the gut also influence communications in the network to the nervous system, now you can begin to understand the large impact that probiotics have on systems of the body and why what's in the gut is core to managing our health states. We now know with work that had been done with Living Metrics and Dr. Priya Kamani at Living Matrix, what they've looked at in over 70,000 clinics and more than, 70,000 patients and more than 370 clinics, they found out that issues in being able to manage and stabilize the gut are common to virtually every chronic disease that comes and presents into clinics today. And so when you're talking to your patients, it's pretty clear that the gut always has to be managed as part of the overall system, whether you're managing cardiovascular health, stress or mood and anxiety. The gut has to be part of a foundational support program and therapeutic regimen that'll help you manage and improve your patient's outcome. And the reason why that's the case is that in the gut is where metabolic functions start. There are protective functions not only in the immune system, but also in the functional capacity of the gut itself. And we know that there are structural and histological changes that occur in the gut. So for example, when you think about structural issues, the concept of leaky gut contributes to and is a result of inflammatory processes, and that causes a number of structural deficiencies that lead to actually dysbiosis. The protective functions of barrier protection are then compromised, and that leads into a progression of a number of different complications. So by maintaining the integrity of the gut, as well as trying to influence the microflora and the microbiome and the profile of microbiome, it's really important then to stabilize that gut because the progression to disease states can be minimized. So systems biology is nothing new to anybody listening and participating in this webinar, right? We now know that because of the metabolites that are produced in the gut and their bioavailability and the ability to communicate to the central nervous system, the gut plays an important role in influencing every system in the body. And so whether that's gut-brain function or whether it's gut-liver or even gut HPA axis, we now know that the gut plays an important role and needs to be stabilized to be able to improve total systems outcome. And this gets away from the concept from symptomatic management into systems management, where we now can, with confidence, describe these things as core to systems management is gut and gut health. So as part of the therapeutic order that you're all familiar with, or the functional medicine matrix, it's a sequence of events from hierarchy that can be addressed and better understood to help you decide what probiotic product, as an example, would be best to help you support the overall therapeutic care of your patients. So let's start a little bit with understanding the microbiome and what we now know as a result of probably about 15 to 20 years of studying, primarily from the Human Microbiome Project. Probiotics are living organisms, right? And so we all know that, but we now know that there's a genetic profile of these organisms that determine what they do. And so different probiotics can metabolize and produce other even nutrients and other compounds or metabolites. They have the ability to influence metabolic processes. And by understanding the genetic profile of probiotics and strains, it helps us to understand what do these probiotics specifically do. And by understanding their genetic predisposition, which determines their function, we can then pick and choose what role do they play in any particular condition or any particular role in stabilizing the gut. And so that's really a starting point, and there's great science behind that and great science behind the strains that we'll be talking about today. And so as an example, we can select probiotics today based off a metabolic profile on understanding how they influence energy, how they influence carbohydrate or protein metabolism, and how they might convert metabolites into other intermediate metabolites that then would be absorbed and have an influence on metabolic processes. And so understanding this basic concept and having the data to support the selection of any probiotic, it becomes easier to understand the specific role of why certain probiotics should be selected for any certain functional capacity influence. And so as an example, if we go to a 10,000-foot view, we now know that the healthy microbiota is important because it affects a number of different issues, from cardiovascular health to metabolic health, body weight regulation, intestinal permeability and immune modulation, and even cognitive performance. And it's all based off of being able to make sure you have a diverse microflora, but specifically understanding what strains and what probiotics have greater influences in any one of the processes that are described on this slide. So let's move a little bit and talk about the continuum of digestive health, because it's really important to understand where in this continuum of digestive health does your patient fit. And so I would present to you this continuum from left to right of the patient profile and the status of their gut health at any particular visit to you, ranging from those people who are presenting and have a healthy and balanced gut, to those who may be reporting infrequent or even frequent irregularity, to those that have chronic digestive discomfort resulting from or as a result of dysbiosis, to very specific functional impairment, and to outright digestive disorders. And so by selecting the right combination of prebiotics and probiotics and even postbiotics, it's important that we can identify for any one of the conditions on this continuum, where does your patient fit and what's the solution that you want to try to solve for. Understanding overall that what's really important is to consider that a probiotic will have an influence on the metabolite develop or occurring in the gut, and that influences the metabolic processes and the metabolome of the body. And why is that important? Because it's the metabolome that determines the progression of any chronic disease. And if you can't catch it where it begins to start playing a role, which is the gut, then it'll be harder to manage those conditions and to stabilize your patients. And so it's important then that we go beyond our thinking from just trying to influence the microbiome into understanding how to influence the metabolome of the microbiome and how to influence the metabolic processes of human disease. And that's the basis of the development of probiotic products as part of the Hyperbiotic portfolio of products. As a result of being able to do that, it's then possible to look at and address any one of the conditions that you see here, plus some others that are important, and more importantly, to be able to identify those patients who may be at risk and to be able to stabilize their guts sooner in the process as they are having frequent visits with you. So let's talk a little bit about some of the science behind dysbiosis and talk about what's influencing that whole process. So dysbiosis will alter the metabolome and lead to a progression of digestive disorders that contribute to the development of these chronic diseases. So dysbiosis is a result of when you lack diversity in the gut, you don't have the right balance of healthy probiotics, or you don't have the right balance of those probiotics that have the biggest impact on the metabolomic processes or the production of metabolites that then determine the metabolome of the body. And so at the simplest level, it's really important to fix the dysbiotic state by making sure that you introduce diversity with the right balance of strains that will allow a healthy gut and a healthy metabolic process to take place. If you recall from the previous slide, if you consider that continuum in the progression of compromised gut health, if you can't do that early on, then what will happen is the gut will go into compromised functional responses, greater irregularity, gas, bloating, really digestive discomfort. And if that's not managed well and fast, then that leads into advanced conditions and compromised health conditions where precision biotics are really important, where they have a very specific targeted benefit against a very specific component that's contributing to the progression and complications of advanced chronic disease states. And so understanding how to develop balance or homeostasis in the gut with the right selection of probiotics is important. Understanding how to have barrier protection and understanding how to manage or reduce the inflammatory processes that take place in the gut and that affect immune response are really critical. And so that's the basis of understanding what probiotic products should I pick. It's understanding what's happening in your patients in that continuum and then pick the right solution. So with the right set of probiotics, not only can you change the microflora and make sure that it's diverse, you can offer barrier protection. You can also influence the immune system. You can have antimicrobial effect, and you can also have certain probiotics that may release bacteriocins or proteins that help provide protection, and other probiotics that proliferate quite extensively and quickly so that they can basically outnumber the bad bacteria in a way that then helps rebalance the gut and provide greater diversity in the gut. So probiotics play a key role in the core systems by first influencing the metabolic processes that we've been talking about. It provides barrier protection to make sure that leaky gut is avoided and the immune system is functioning. It supports immune modulation as a result of that. And ultimately, it also contributes through the metabolic processes to an improved nutritional effect and nutritional support that's really important in that overall stabilization of the gut and minimizing progressions to complication of digestive diseases. So dysbiosis is an inflammatory response as a result of a lack of diversity and a lack of appropriate profile of positive bacteria. It's also important that when you introduce probiotics that with this early to mid stage of complications that patients may be diagnosed with, that you start trying to influence immune response for better inflammatory controls, provide barrier protection, and then ultimately improve metabolic functions. Now, there are a couple of lactobacilli that are very specific to a very specific immune response, and Diane will talk a little bit more about that in several slides, but this is the kind of science that's available today that can go beyond just an immune response into a very specific issue. For example, during seasonal colds, where there have been great clinical studies that show the immune impact has a direct effect on some outcome or health state. And so that's the level of science that we now know about probiotics that we'll talk a little bit more about in a few slides. It's also important to understand barrier protection as a major benefit on the selection of the right probiotics. And so barrier protection is important because if you have leaky gut, which means separation of these intestinal lining cells, that inflammation is likely to occur, progression to disease states can happen, and probably the wrong metabolites are getting across the barrier and having a negative effect on metabolic processes. And so leaky gut is an important component that can also be addressed by a very specific probiotics or combination of Synbiotics, as well as in the appropriate use of postbiotics that play an important role. Now, tight junctions protect against autoimmunity, and we know that leaky gut occurs across a number of chronic disease states. So even if a patient may not be reporting digestive discomfort and they have a chronic disease, the chances could be pretty high that they are suffering from leaky gut, but not to such an advanced state that it becomes problematic for them. And so when you have patients that are presenting for other conditions, it's important to make sure that as a supportive regimen, that you're providing a diverse set of probiotics that help stabilize the gut to make sure that inflammation or leaky gut doesn't progress to advanced stages that lead to even greater complications in whatever health condition that they're currently experiencing. It's also true the gut brain axis plays a critical role, and this also affects communications across the nervous system network and influences specific axes like the HPA axis, which play a very important role in being able to manage and modulate stress and anxiety responses and mood states. And so that all starts in the gut because metabolites are created by certain probiotics that are breaking down certain foodstuffs into metabolites that may contribute to the development or progression of anxiousness and other mood disorders. So the body is all connected. It's influenceable and can have its greatest impact by managing activity in the gut. And so this is just another example, again, of how the systems are coming together, and then understanding the mechanistic framework will help us determine how to select and put together the right probiotics in a way that can address the mechanisms that are now well understood and have been identified. One of the topics that is getting more and more attention is what's called the gut-brain axis. And we now know today that by changing the metabolites in the gut and the higher production of components or intermediate metabolites like GABA, that those compounds influence the nervous system network, provide communications to the HPA axis and to mood centers in the brain, and change the firing capacity or the communication response in the central nervous system. And so making sure, again, that the right metabolites are being produced with the right combination of pro and prebiotics through a symbiotic becomes really important in being able to manage these cross systems. And so the gut axis and the gut factors play a core role in understanding systems biology, if you will, or managing health systems. And so we can describe the framework of mechanisms of influence, and that then becomes an important starting point in being able to select probiotics that can have an effect throughout the continuum. And you want different probiotic profiles in dysbiosis versus advanced chronic disease states where Precisionbiotics become even more important. I want to talk a little bit about why just giving probiotics may not be enough anymore. And that's particularly true for dysbiosis and definitely the case for more advanced conditions. We now know that phytonutrients played an important role, but as we consume, let's say, blueberries or strawberries, and then they're phytoactives like anthocyanidins or catechins or polyphenols, what we now know, especially in the last 3 or 4 years, is that it's the probiotics that are in the gut when phytonutrients or fruits and vegetables are consumed. Those probiotics metabolize those fruit and vegetable compounds and convert them into intermediate metabolites. And that action is what creates an influence on the metabolome of the microbiome that influence the metabolic processes of the body. So if you're providing probiotics without a symbiotic understanding, and particularly with the right selection of phytonutrient combinations or the right prebiotic, the metabolites that the probiotics will cause these compounds to be converted to or to be formed may not be ideal, and they may be contributing to the progression of chronic disease states. So understanding that it's the pre and probiotic combination that has a powerful effect in being able to quickly manage issues like dysbiosis and to stabilize that, and also to quickly help avoid the progression to complications of chronic conditions becomes a very important clinical treatment regimen. And the reason why that's true is that, again, it's the intermediate metabolites, not the metabolites or the compounds we think we're consuming, because they're all converted. They have very specific effects on the brain, vascular functions, you name the system, it's having an effect. And it's that network that makes the gut so important as a core influencer in being able to manage entire systems of the body. So you may have patients that just think they have a digestive disorder, but you may have other patients that have just a chronic disease, and guess what? They're all connected. It's all interrelated. You got to fix the gut or maintain the balance of the gut to be able to fully manage whatever, even advanced stages or chronic conditions that you're trying to manage. They go hand in hand in a therapeutic regimen. And so part of what's unique in the Hyperbiotics portfolio of product is that we've combined the concepts of the right probiotic combinations to provide for greatest diversity with a prebiotic that we can identify has very specific effects that are listed here in this slide. We can identify what those polyphenols are, but more importantly, we know what they're converted to. And we know which probiotics have an influence on the conversion of those metabolites into the intermediate metabolites that then influence the metabolic processes in the gut. And what you see in our portfolio is that those products selected by condition and by patient segmentation play a powerful role in being able to manage a continuum of issues that we talked about several slides ago. We now know that it's the symbiotic effect that is really important, along with making sure you have gut diversity, because the right selection of a group of probiotics that are synergistic and complementary into phytonutrients and the prebiotic effect for its greatest effect to occur. And that can be ranging from solving for leaky gut, increasing barrier protection, making sure that immune modulation and resolution of inflammation is taking place, but it happens as a symbiotic and a very synergistic process between the probiotics that are selected and the prebiotics. So let's talk a little bit about with that background, that framework, and that understanding of what's really happening in the gut. It's not that we're just loading a bunch of probiotics and you hope they colonize, is they have to colonize with purpose. They have to colonize with being able to have metabolic influence that affects health states. So here are 5 criteria that are really important to understand in the selection and review of any probiotic product, and then specifically the series or the number of probiotics that might be available in any product. One is to be able to understand, is the strain characterized? Do you know what the genomic influence and metabolic potential is? Do we know that the viability of the strain is good, or it's being delivered in a system that is very stable and then gets to where it needs to get to be able to have its greatest effect? We know, as an example, that you want to have a great balance between the lactobacilli and the bifidobacteria. And so depending on where the targeted role of effect that you want to have is, if it's in the small intestine, you want to have a greater ratio of lactobacilli. If it's in the large intestine, you want to have a greater ratio of the bifidobacteria. And so part of the hyperbiotic formulations are based off of that balance of lactobacillus to bifidobacteria strains and what their metabolic influence and processes are that are strain specific. The third criteria then is to make sure, how can you influence and make sure that the gut is as diverse as it can be? And that means multiple strains at the right level of activities. And so you'll see in the hyperbiotic products across any patient segment, we provide anywhere from 5 to 15 strains, depending on what the effects are, depending on what the specific benefits and role of the probiotic strains are, with a prebiotic, in a way that we can have a maximum effect on balancing the gut and being able to address dysbiosis quickly and being able to avoid progression into some of the more advanced stages of digestive disorders. And that's number 4, there's understanding the metabolic processes. We've done that for you in the nomenclature of our products. And then lastly is making sure that there's preclinical and clinical data to show an improvement in outcomes. And we have a clinical reference library and database that's available to be able to support all of the strains that we have. And Diane will dive deeper into them in a few more slides. But before we get into that, let's talk about a number. You know, most of you are familiar with the concept. It's 50 or 60 billion CFUs, levels of activity is the answer. And the real answer to that is maybe. So it depends on what's the viability of the strain itself. And perhaps more importantly is, if you're choosing your product that has a technology that makes sure that it can get through the stomach and survive the stomach acid to where it needs to get, is that possible? And so that's another advantage of Hyperbiotics, is that our delivery technology protects the strains in a way that they survive the entire transit time of the gut, and they survive so they can have their greatest effect of where they end up being delivered. And so because of that, we've been able to scientifically really determine that it's not 50 billion CFUs, an example, but it's the clinically efficacious threshold that's important that we're delivering, and we're protecting it in the technology that we use to deliver those probiotics. And so this is a slide that talks about, you know, what the density is of the different strains throughout the entire gut, from alimentary canal, from our mouth all the way down to the ends of our digestive tract. We know what the predominant strains are at any one of those phases. We know what the level of acids are in all of those, and we know essentially what the survivability potential will be then of any strain, because we know how robust they might be, and we know which ones need to be protected, and we know how to protect them. And so that also changes in the aging process. And so depending on patient segments, they also have a different profile of activity throughout the entire length of the gut. And they also have different predominance of any one strain in any part of the gut. And we know what that is. And so when we have designed our portfolio of products, it's also reflective of that by targeted patient segment and by targeted condition. And so let me turn it over to Diane a little bit to tell you a little bit about this protective technology that we've developed with Probi, and that's why we can deliver 15 million GFU rather than have to worry about 50 or 60. Diane?
Exactly. So Biotract is a patented technology that Probi developed over 10 years ago. And like John mentioned, it helps to protect the probiotics from the acid in the stomach. So essentially the components of the tablet form a gel when you consume it, and the tablet becomes hydrated. And that gel essentially protects the probiotics and the other active components in the tablet from the stomach acid, and increases the survivability of the strains and the activity of the other ingredients, so you don't need those extremely high levels of CFU in the formula. And then, interestingly, as that tablet hydrates, the outer gel slowly erodes and sloughs off as it moves throughout the small intestine. So you get a more prolonged and consistent release of the probiotics and active ingredients. So you have more opportunity for the probiotics to colonize throughout the digestive tract. So you don't have to worry about, well, is it going to, be only delivered in one spot of the intestine, like you might find in a delayed release capsule. You get a more prolonged delivery, again, so the probiotics have the opportunity to colonize the entire gastrointestinal tract, especially if you have bacteria like bifidobacteria, which tend to colonize more in the large intestine because they are strict anaerobes. Go ahead. And this, again, makes a really unique delivery form and really enables your patients to get the maximum benefit from the products. And you can have a greater time release and greater efficacy as compared to a regular veggie capsule that you find in typical supplements. This is a really unique benefit that the Hyperbiotics brand has to offer.
And so, thanks, Diane. So here's a quick fingernail sketch of the Hyperbiotic portfolio, going from left to right. And you can see the ones on the left provide digestive function regulation through patient and condition-specific support, and then to the right, advanced clinical and very specific support. The number of level and the level of activity of each strain, again, is the clinical efficacious threshold supported by the technology that Diane just talked about, and then each of the strains that are provided in each of the products meet the criteria that I was describing in the previous 20 minutes or so. These tables are available on our website if you have a chance to take a look at those. But we list all the strains, and then you can see at the bottom the prebiotics that we use that have that synergistic effect and being able to influence the metabolic processes. And so the strains that we select go from maintaining health, like the Pro 15 or Pro 15 Advanced, into dysbiosis. For example, the immune product also includes a postbiotic from Epicor that play really important roles into our condition and patient specific segments that reflect the very specific issues that are frequently faced by each one of these special groups. Of the major strains of probiotics that we have in the Hyperbiotic line, they all meet the 5 criteria that I was describing to you a few slides ago, and we're able to define all the criteria that we think are important and have other studies, both scientific and clinical studies, that can describe very specific benefits on their effects and uses. But let's go now to the Precisionbiotic, to kind of like the end of the continuum of digestive, which is the most complicated, most challenging part of digestive disorders to take care of, and dive a little bit deeper into the science with Diane. Diane?
Thanks. So these strains, or these blends of strains that I'm going to describe to you, are some of them are found in the Hyperbiotics line, and some of them represent opportunities for new product development that we're working on within the line. So our flagship strain at Probi that was identified by the gastroenterologist that kind of started Probi was Lactobacillus or Lacti-Plantibacillus, now that the taxonomy has changed, Plantarum 299V, or LP299V for short. And since this probiotic has been researched for over 30 years at this point, we have more than 200 publications that are publicly available and over 65 human clinical trials, really showing its benefits for digestive health, specifically around IBS, as well as its very extensive safety profile. Jump. And what's also unique about LP299V and a number of our probiotic strains is that consumers and patients actually feel a difference. They feel the health benefits that they're receiving from the probiotics. Obviously, unlike a lot of other dietary supplement ingredients that people are just really taking on the science. When subjects in our clinical studies took LP299V, this chart right here is an example from one study. The individuals, the subjects who had consumed LP299V, almost 80% of them felt like the probiotic was giving them a benefit, as opposed to less than 10% in the placebo group, really showing that your patients are going to feel better, so they're going to continue to take the probiotics, so you don't have to worry as much about compliance. Next slide. And LP299V has a number of benefits compared with other probiotic strains. We have data that shows the LP299V strain increases diversity of other probiotics or other bacteria in the digestive system, and it also is able to bind to the mannose receptor in the small intestine, essentially crowding out other pathogenic bacteria that bind to that same receptor. And this is an example, sort of a diagram of that binding mechanism, where LP299V is binding to a specific receptor in the epithelial cells of the small intestine, essentially crowding out other bacteria. And additionally, this binding really initiates a signaling cascade that it creates, a lot of inflammatory marker modulation to really inhibit and reduce that inflammation that can occur in the small intestine, and also increase mucin production, which is another mechanism of the probiotic to inhibit pathogen binding. And this is just an overview of the most important clinical studies we have. Most of these were conducted in IBS patients, and all of the studies have very similar positive results, showing that in the patients who had LP299B, they had a reduction in their abdominal pain, a reduction in bloating, flatulence, as well as bowel normalization. Next slide. And another really interesting probiotic solution that we offer that has quite a bit of clinical substantiation is what we call ProbiDefend, which is a blend of 2 different lactobacillus strains, an L. Plantarum and an L. paracasei. And we have 4 clinical studies really looking at the common cold as the marker of efficacy. And we have studies in both adults and children showing that ProbiDefend reduced the number of cold episodes throughout the cold season, also reduced the severity of those cold symptoms, the duration of the colds, and also recurrence of colds throughout the 3-month cold season. John. So this is just one example showing that ProbiDefend reduced the number of cold episodes compared to the placebo group, in addition to the reduction of severity of symptoms. And this graph shows the reduction in cold episode length, where you had about an 8-day cold period in the subjects who consumed the placebo, and about 6 days that the symptoms lasted in the ProbiDefend group, and that difference between the groups was statistically significant. So a number of different benefits with ProbiDefend, and what we, from our data, both in vitro data and our human data, is suggested it helps to balance out the immune system, so you don't have that kind of overactive inflammatory response, but you also have almost a priming of the immune system. So when it encounters a pathogen, it's ready to fight that infection. And these are just some examples of the outcomes that we saw in both adults and children. One other really unique area for probiotics that many patients don't, it's not top of mind, it's not the first thing they think about when they think about probiotics is oral health. And Hyperbiotics has 2 really great products to help with oral health, both in adults and children. Go ahead. And these are the 2 products in the line, and oral health is very, very top of mind for patients and consumers alike. And there are a number of probiotics that are found at high levels in the oral cavity, and really what's going on in a healthy oral cavity is that it's helping to reduce the pathogens that are causing cavities and gingivitis, essentially forming a biofilm to crowd them out, and also modulation of the inflammatory response. And many of these probiotics actually produce molecules that inhibit pathogens as well. So a number of mechanisms where the probiotics are really using to enhance and protect the oral cavity. And there's 2 main strains found in the probiotic line that have an abundance of clinical research. They've been researched for over a decade. They are Streptococcus salivarius strains, and one is labeled K12 and the other is M18. And specifically, K12 has quite a bit of research in children, specifically showing a benefit for ear, nose, and throat health. So in this study, they showed that those children who had the K12 had a reduction in their sore throats. So, and there are many other studies showing similar benefits with the K12 strain that's found in the kids' ENT product in the Hyperbiotics line. Next slide. And this is just an example of all of the ear, nose, throat data that's published on the Streptococcus salivarius K12 strain. You can see reductions in tonsillitis, pharyngeal infections. Again, the strain really helps to kind of modulate the immune response and also protect the upper respiratory tract from pathogenic infections, really providing a really robust layer of protection. And we've also shown that it can reduce the recurrence of otitis media or ear infections in children as well. So not just, sore throats, but also ear infections as well. So you can see here in the children who had recurrent infections and that were treated with the K12 probiotic, they had a reduction in their incidence of ear infections.
Great, thanks, Diane. So I hope we've covered with you a couple of important features of the Hyperbiotics line up to this point before we start talking about clinical guidelines. Number one is that diversity in using probiotics is important. And so having a formulation that has a number of probiotics that are complementary with each other can have an important effect on balancing the gut. It can have an even greater effect if you combine the probiotic with prebiotics, particularly phytobiotics, and also with postbiotics. And so we know that synergistic effect plays an important role in being able to balance and influence the metabolic processes that is really what's happening in the gut that we're trying to manage. And so those are important features. We have 5 criteria that are important. You don't really have to worry about those 5 criteria because we've done that work for you and used those 5 criteria to develop the formula. And so they're available across the line. And we provide a protective technology that's unique to the Hyperbiotic line that makes sure that we're delivering viable, active probiotic strains at the threshold of minimal clinical efficacy. So we'll share with you a couple of different protocols. And so keeping in mind that as you select these probiotics, you should obviously be as specific as you can to the condition that you're trying to manage, the stage in the continuum of that condition that you're dealing with, and as much as possible to further refine the selection criteria or the selection of products based off of the patient segment or the patient profile that you're working with. And so by being able to do that, you'll be able to address these 6 issues that we've listed here as important system approaches in selecting probiotics and being able to manage gut health. So we're not going to go through all the details of this. They're also available later in the presentation and online, but they're decision trees and algorithms that we have to help you decide what sequence of events and what products would be most effective for you to use. So the first protocol that we have available is using and understanding the pro-symbiotic option for preventive care and for managing irregularity of dysbiosis. The second protocol is really managing that range in the continuum of gut health from dysbiosis to functional impairment. And we look at this as really 6 weeks, even as long as 12-week blocks of time where you can provide the appropriate hyperbiotic product or probiotic and prebiotic strains together, and then be able to monitor the patient as you normally do. And then as needed, if you're seeing a good response, what other nutrient protocols and therapeutic solutions can you offer or add to the therapeutic plan as you move through the 3, 6, and 12-week blocks of time of managing your patients. And so the most advanced protocol is illustrated here for digestive disorders. This is where the Precisionbiotic comes into play. And one other component or insight that I'd like to share and emphasize too is that just as one probiotic or probiotics alone may not be the solution, provide the solution that you need, because it's a combination. It's true of nutrition in general, right? Just by giving vitamin D as an example, or one probiotic isn't necessarily going to solve the issue that you're trying to solve for. And that's the importance and the power of understanding systems biology and why co-therapies, particularly in the nutrition world, are really important. So phytonutrients have really a co-therapy benefit that's really important and needed with probiotic use, but so do other products like omega-3, DHA, curcumin, and even berberine should be used in combination depending on the stage and the response that you're getting from your patient. And we outline and define that for you in each of these protocols. So we encourage you to take a look, go online, take a look at the presentation later on, and download these patient protocols, and it'll give you some insight and some support in your considerations as you start developing a therapeutic plan for your patients. So in summary, at this point, I just wanted to highlight and share a couple things that I hope we have left you with. Number one, diversity is important in gut health. It's the metabolome of the microbiome that's critical. The hyperbiotic family of probiotics is designed to take the most important and complementary probiotic strains, put them together, and in combination in symbiotic formula to be able to influence two important things when it comes to balancing the gut: the microbiome itself and the microflora profile, and most importantly, to be able to influence the metabolite production and the metabolite availability that will influence metabolic processes. And then the last piece is our technology that we deliver. It provides a protection to make sure that the level of activity of our formulas meet the clinical efficacious level that's important, and they get to where they need to without concern of focusing on basically numbers of CFU activity rather than functional impact and influence. So with that, let's stop here, and if there are any questions, we're happy to take some time and answer or provide further clarification for you. Thank you.
That was awesome. So much valuable information. Thank you for going through that. I know we have a few questions. I'm sure a couple more will come through as we're chatting too. Some of them were also kind of maybe asked at the beginning of the presentation. I thought I'd maybe repeat them, and even if you have gone over them, just for people who maybe join later or who will ask the same question. But this first question came in towards the beginning, I believe, when you were talking about gut access / gut factor, John. If a client is taking HCI or even high doses of HCI to rebuild stomach acid, would you suggest they rebuild stomach acid first and then add in a probiotic, or are they fine to take together?
Yeah, no, I think that's a good idea, is to rebuild the acid load, and then once that's stable, then provide the product. Now, having said that, I will say that our protective technology is not going to be influenced by that, right? Because we don't really worry so much about, delivering probiotics or symbiotics into the stomach. We're talking about the small and large intestines as the primary sites of activity and balance. So you could do it together, but usually you stabilize each part of the system of the pipe, if you will, and then start going after more specific therapeutic targets.
Okay, and the next couple came from the beginning of your presentation, Diane. So, although it might be for both of you as well, which formula would you recommend for a woman that just went through a breast explant surgery, anesthesia for 5-hour surgery, anti-nausea drugs, and antibiotics, or kind of what would you recommend for this woman?
I'll let you take this, John.
Yeah, so that's the challenge, right? So my personal suggestion would be to start off with immune, mostly because the biggest issue that I think patients like that are going to have is that you've got to reduce and resolve the inflammatory system. She must have high levels of inflammatory response, and she's got to reduce those to be able to heal faster. And so probably one of the best ways in our portfolio is with immune. And then from there, I would go to Pro 15 Advanced. And then depending on whether specific issues that she may have in, overall in her systems, you could look at any one of the condition-specific solutions that we have. But immune and Pro 15 Advanced would be the first two that I take a look at and start with.
I'm just seeing there's a few more coming through. This one is kind of general too about the products. I would love to recommend these products to my athletes. Are they all products NSF certified?
Yes, they're all manufactured. Yep, they're all manufactured in our NSF certified facility, and we're also NSF certified for sport as well.
Oh, awesome. That's great. the next question that came in is a little longer too. What do you think about the 5R approach for GI issues? I've always thought it was recommended to remove triggers, replace, and then re-inoculate the gut.
Yeah, so I am I guess I don't know what the right word, believer in the 4 or the 5R, depending on which number of R's that you believe in. But the thing that I have to say that was new since the 4 or the 5R concept were first introduced somewhat 25 or 30 years ago is that we now know the genetic profile of the strains influence their ability to influence metabolic processes. And so what's really important is by understanding and appreciating its influence on the metabolome, you don't have to remove, because what's happening is you can shift the metabolic processes while you're trying to stabilize. So stabilization doesn't necessarily remove as much as it means to replace, or to be able to have a stronger system of influence in the gut. And that's why our combination products can be very powerful earlier in the sequence. And so, you can go from, if you're using the 5R concept, you can probably go down to 3 Rs and start using selected products in our portfolio more effectively.
We have a couple questions that have come in about leaky gut. So the first is, what test is preferred to identify leaky gut / tight junction?
Diane, I have a view on that. It usually boils down to being able to test for zonulin, but I don't know how the scientific or clinical community looks at that test these days.
Yeah, it's a little bit difficult in human clinical studies, but a lot of it is done in cell culture and translated into mechanisms for humans. So, but you're right, it's the zonulin that keeps the tight junctions together.
And the other question, which you may have also touched on, is which probiotic is generally useful for leaky gut?
Well, the entire family of L. salivarius is pretty effective, but also the product in our portfolio is ProbiDefend, also has good data. And then also our product called Immune, which has Epicor in it as a postbiotic, also has very specific studies to help address and solve leaky gut. So at least one of those two products, Immune or ProbiDefend, have specific data on leaky gut.
There's definitely a few very specific questions coming in about like their people's own patients, which is great. I'm trying to go back. This one that came through is regarding the mention of the importance of pre and probiotics as they influence the metabolome. Is the concern for making sure they are taken together, or is it the type of probiotic?
Well, it's really both. So it starts with the type of probiotic, because different probiotics have different effects on metabolic processes or digestive processes and metabolic processes. So you've got to get the right probiotics, but we've done that across our line, so you don't have to worry about that. You can focus on the condition or the patient segment that needs to have some influence on the metabolic processes. The other thing that's important is part of the advice that I believe should always be given to patients, particularly in digestive management, is getting them to understand they've got to get nutrient-dense foods in their diet, and picking 1 or 2 fruits or vegetables is not enough, right? There's a reason why the USDA recommends 5 servings of fruits and 5 servings of vegetables a day. We try to make that easier with our product profile, because we provide highly concentrated prebiotics to make that a little bit easier, but you got to do both, right? It's like it's the probiotic and it's the foods you eat, and it's the prebiotics that you could add as supplements to make it even more effective faster.
So I'm conscious of time. I have a couple more. Actually, a couple of easy ones on what you would recommend. So which probiotic formula would you recommend for methane SIBO? Did I say that right?
I would say probably the ProbiDefend as well, because you're really trying to establish a more robust community throughout the digestive tract, and you don't want to, you know, kind of do anything to promote the SIBO.
And then I will be, as I said, I'm conscious of everyone's time, so I think there's a couple, I think we actually got to most of them. If there's any more, I'll end on this one though, your recommended or the best probiotic for anxiety.
Oh, it's our product, Gut Brain Balance, GBX. So that's been formulated to basically influence the intermediate metabolites that are produced in the gut that influence the central nervous system communication links back to the brain.
This is great. I know there's been a couple questions on having the resources. Yes, you will all be getting a recording too. So if we can provide these slides, we absolutely will. Any protocols as well, we can link in a follow-up email, as well as it'll live on Fullscript's website at fullscript.com/webinars. So any resources we can provide, we will. I want to thank you, Diane and John, for being here today. What an amazing presentation, full of valuable information and lots of engagement in the questions and lots of love for the presentation. So thank you so much. And thank you everyone for joining us too today, taking the time out of your day. Again, you'll get a follow-up shortly, and be sure to keep an eye out for more webinars, and hopefully we'll do more with John and Diane in the future.
Great, thanks everybody. Have a great night.
Thank you.